Chemotherapy attacks fast-growing cells, which includes blood cells, specifically your white blood cells, red blood cells, and platelets. Your white blood cells help fight against infection. When you receive chemotherapy, your white blood cell count can decrease. When this number is below normal, we call this neutropenia. Neutropenia, or a low white blood cell count, occurs around 7 to 10 days after treatment. This is the time frame when your blood counts are at their lowest between treatments and is called the nadir period. When you are neutropenic, you are more susceptible to infection. During this time, it is very important to monitor for signs and symptoms of infection. This can include a cough, sore throat, pain or burning with urination, or a fever. At home, monitor your temperature regularly with a thermometer. If you have a temperature greater than 100.4 degrees Fahrenheit, with or without chills, call your cancer doctor. If you are unable to get in contact with your doctor, go to the Gulf Coast Medical Center emergency room. Gulf Coast Medical Center is Lee Health's Cancer Institute hospital. A fever could indicate a possible infection, especially if you have neutropenia or a low white blood cell count. Fever with neutropenia is considered a medical emergency, and you should be assessed by a medical provider right away. The main way to prevent infection when our white blood cell count is low is to wash our hands frequently with soap and warm water. During this time, avoid eating raw food, such as sushi or sashimi. Be aware of ingredients in what you eat to ensure food is properly cooked. When your white cell count is low, you should avoid crowded places and avoid contact with people who have signs or symptoms of a cold or the flu. Also, do not share food, cups, utensils, or other personal items, as this could increase your risk of infection. At home, carefully wash your raw fruits and vegetables. Also, avoid eating these items at restaurants. Produce that is canned or has a thick peel on it is ideal for limiting exposure to bacteria. Ensure your household surfaces are clean and you are maintaining good personal hygiene. It's best to avoid houseplants and dried or fresh flowers, as they have bacteria present on them. If you are gardening outside, wear gloves to protect yourself and wash your hands afterward. Lastly, protect your skin from direct contact with pet bodily waste by wearing gloves and washing your hands. Your red blood cells carry oxygen from your lungs to the rest of the body. Anemia occurs when you have low red blood cells or dysfunctional red blood cells in the body. This leads to reduced oxygen flow to the body's organs. Symptoms of anemia may include fatigue, pale skin, shortness of breath, lightheadedness, dizziness, or a fast heartbeat. Management of anemia is mostly rest and energy conservation. Listen to your body and take your time if you feel anemic. Report any symptoms of anemia to your cancer doctor or treatment team. If you experience chest pain, report this immediately and call 911 or go to the closest emergency department. In severe anemia, your doctor may place an order for a blood transfusion. Platelets are cells that help stop or prevent bleeding. When our platelet count is below normal, it is called thrombocytopenia. Without our platelets to form blood clots, bleeding can be extremely difficult to manage or stop. This can be very dangerous. Signs and symptoms of thrombocytopenia include excessive bruising, tiny pinpoint red spots on your skin called petechiae, bleeding gums, especially after you brush or floss your teeth, nosebleeds that do not stop, dark-colored urine or blood in your urine, and blood in your stool, which can be bright red or black-colored. The primary means of managing thrombocytopenia is to avoid or prevent injury. When shaving, use an electric razor instead of a manual razor to help minimize cuts. When you brush your teeth, use a soft bristle toothbrush. Avoid strenuously blowing your nose. If you find that the nasal cavity is dry, you can administer over-the-counter saline spray to help keep your nasal cavity moisturized. Manage any issue with constipation and avoid straining during a bowel movement, as this could lead to a bleeding or a hemorrhoid. Lastly, avoid medication, including herbs and supplements that may affect your body's ability to clot blood, unless otherwise indicated by your doctor.